Well, welcome to the Daily Brief on Metro Milwaukee's health and economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. The webcast is powered by Aurora WDC. We also want to welcome back Mayor Tom Barrett as our guest today. But as we do, let's start with our healthcare update from Dr. Raymond.
Thanks, Tim, and good afternoon, everybody. I'll start with our scorecard, which continues to show improvements in the growth rate of COVID-19, which is now down to 10.9% today from initial rates over 3 weeks ago that range between 30 and 35%. Our doubling times have stretched out from less than 3 days to 6.35 days today. Very good news. And there were 183 new cases in Wisconsin and 91 in Milwaukee, which is in the range of numbers from recent days. Next slide, please. This next slide shows the calculated doubling times of COVID-19 in Wisconsin over the last 3 weeks. Again, showing good progress and I believe a positive impact of the safer at home order and the social distancing interventions that we've all implemented as individuals and organizations. Again, good news, although we won't know the impact of the in-person elections on April 7th until early next week, or the impact of this upcoming weekend's religious holidays until next weekend. Next slide, please. All of us are trying to think through how we can protect ourselves and our people from coronavirus, and how we can balance that with when we can smartly restart the economy. We know coronavirus is a frightening disease. People still are spreading it silently without knowing it. We've not been challenged by a pandemic like this since the Spanish flu in 1918. We have no validated treatment and no cure yet. There is no vaccine, and we have shortages of tests and personal protective equipment. And we also know that communities around the world are seeing a second wave. Singapore, Hong Kong, Japan, many of which were touted as previously having gotten it right. And we'll need to watch carefully to see what happens there over the next few weeks. Now, I know that all of us look for hope in every news report, dashboard, model, and commentary. I certainly do. But we also know that globally and locally, we'll be fighting coronavirus for a long time, most likely until we have an effective vaccine, which, barring a breakthrough in technology, is probably 12 to 18 months out from now. But we can't allow this disease to control every part of our lives. We need a thriving economy. Our COVID-19 economic challenge is unprecedented. The only comparable challenge was the Great Depression, and we all need to get back to living well. And until we can treat or eradicate COVID-19, we need to develop a plan to live with the disease around us without allowing it to get out of hand. And our economy is the heartbeat of our region. Under the MMAC leadership, we've been working hard to develop practical guidelines and actionable procedures to responsibly get businesses back into operation and to manage the ongoing challenges of coronavirus. We all know we need to restart the economy urgently. I know that personally because MCW is a significant employer and contributor to the economic vitality of our region. We have 3 challenges: time, tools, and timing. We need the time to responsibly agree on procedures, deploy tools in our workplaces, and educate ourselves and our employees about best practices for specific industries and sectors of our economy. We need tools like personal protective equipment and reliable COVID-19 testing in sufficient quantities so we can keep our workers, the community, and our customers safe. We also need to be able to perform diligent surveillance and early quarantines and contact tracing when necessary. We need to get the timing right. We know there will be flare-ups of coronavirus as we begin to reactivate the economy, and we understand that we're taking calculated risks when we eventually restart the economy and activate our community. We also know that sector-specific phasing of the economy and its recovery will give us our best opportunity to put this disease in a manageable place and remain under the crisis curve until we find a vaccine. I know that each and every one of us wants to know how we can help to activate the economy in a way that keeps us under that crisis curve. First, we need to make thoughtful recommendations and balanced decisions. And second, we need to do everything we can to have adequate testing capabilities and PPE for healthcare providers, our workers, and for the community. Thanks again for all that you do, and thanks Mayor Barrett and Tim Sheehy for your leadership and resolve. Tim, I'll turn it back over to you.
Great, Dr. Raymond. Just two questions here before we pivot to the mayor. The first one is, as we've been keeping this scorecard that you've developed, we're inching closer to the doubling time of 7 days. And then the other one we had was the declining rate of new cases over 14 days. So those trends seem to be right. And do I also understand now you're starting to get kind of real Wisconsin data that you can plug into the model? Can you talk a little bit about that?
Sure. We like the trends. They're telling us that social distancing is working and that the interventions that our government and individuals and organizations are doing are really having a positive effect. That's really our best tool. But we also know that those may not be the best metrics to look at our recovery. And so we're going to try to provide an enhanced dashboard starting next week that factors in the numbers of ICU beds we have and some data relevant to a recovery phase of the coronavirus pandemic.
Thank you. And then the second question really goes to your point that while we look out ahead at this recovery in the next phase, the next normal is going to be much different, both in terms of how we act with each other, where we go to, how we go to work, until we have a vaccine.
Yeah, I think that's right, Tim. That's a limiting factor in our recovery is when are we going to get that vaccine?
Mayor, can you talk a little bit about, since we had you on last Friday, what you've seen in the city in terms of the development of the spread of COVID and bring us kind of up to date on that?
Well, we continue to be concerned because we're seeing a huge racial disparity that is probably one of the most pronounced in the entire country. There was an article in the Washington Post that looked at the percentage of fatalities by race, and unfortunately, Milwaukee was at the top of the list in terms of the percentage of people who die from the disease here who are African American. Not surprisingly to anybody on this call, they are hyper-located and segregated into the northern part of the city of Milwaukee. We're fortunate, and it's great that I can thank Dr. Raymond and the Medical College because they have just announced that they're going to work with us through advancing a healthier Wisconsin with a grant that will allow us to try to get into these communities that have been most disproportionately impacted and do it so that we can get the message about the social distancing. But a lot of it, and I think you're going to hear a lot more about this in the coming days, is the social determinants of health and the underlying conditions that people are living in. What we're seeing, and you can read about this nationally right now, is as we come out of this, who are going to be the ones that can come out quickest. And even right now, the highest percentage of people who are able to work from home are people who have a college education. The people who are out there in the grocery stores or delivering the food, those are the people who have lower amounts of education. So you can see how this is having a disparate impact throughout the community. And so we're still witnessing that in a very real way. And that's very concerning. It's very concerning to me. And I know that there's just a lot of unhappiness because I think this is adding to the angst that a lot of people feel in the city of Milwaukee right now.
And you have a double challenge here that I want you to talk about is the poignant healthcare crisis in the city, and as you said, on the north side of the city. But you also have a real challenge now in terms of the fiscal health of the city going forward. Can you talk about that from your perspective and potentially the impact that the federal stimulus package would have?
You're seeing this in virtually every single state. You're seeing it in every local government throughout the country, and we're not immune from this either. And what we're seeing is increased costs, dramatically higher costs, in particular places like the health department. Now, it's our hope that the federal dollars will allow us to offset a lot of that, but we're losing a lot of revenue through our normal revenue channels. But we know that the state is also losing revenue, and just the announcement about the special legislation and what does that mean for aids to local governments? What does that mean to aids to schools, school districts? I think that's going to be a very politically charged argument over the next couple of weeks. And I just would hope that we could work together and craft a solution. I'm not particularly optimistic right now, but I would like to think that the legislators and the governor could work together, because we're going to take a hit, the state's going to take a hit, everybody's going to take a hit. There's no, just as every business that's listening to this has been impacted by this, governments are impacted by this as well.
Let me ask you another question here, and we've been very supportive of your leadership on this. Do you think this just adds more impetus to the need to give local government, the city, the county, control over additional resources so they can determine their futures?
That's a really good question, Tim. That's a really good question. And I thought about that quite a bit myself. Does this help or hurt? It's not a great time. It's never a good time to ask for authority to raise a sales tax. This makes it a more difficult time. At the same time, I'm concerned that there's some people in the legislature who want to take money away from the city and take money away from the county. And maybe this is a place that they're going to look to offset that. That to me is not a particularly good bargain right now, but I know that this is part of the conversation. Ironically, at least in the very short run, that the fact that we are so dependent upon property taxes and shared revenue gives us a little bit of a buffer, because since we don't get any sales tax revenue, the precipitous drops in sales tax revenue doesn't have as much of an impact on us as the county. I think the county is going to lose millions of dollars because of the drop in sales tax, because they have a county sales tax. Now, that doesn't mean that the legislature is not going to come back and say, we're going to take it out of your hide. But at least right now, we're looking at, we're also looking at what do we do once we get through this next 3 or 4 week period in terms of bringing back the revenues that come in. A lot of it's construction revenue and permit revenue. And if we don't see the construction industry bounce back, that's going to have an impact as well. The parking revenue, are people going to come down? Are they going to congregate as they do in the summer in Milwaukee? That's where we get a lot of revenue from a lot of those events and the parking that comes with that. We're in a different world now. And I don't know that we're going to see as many venues that are filled with people, at least in the near future. So of course, I'm very, very concerned about that. And we're monitoring it very closely and watching to see what the federal government is going to do for local governments as well.
Yeah, thank you. Very challenging times. I'll bring Dr. Raymond back on with the mayor. And Chris, we've got questions from the audience.
We do. The first request was for Dr. Raymond to go back to the scorecard slide and maybe go through those numbers a little bit more.
There you go.
Okay. Yeah, our doubling growth rate, or the growth rate of new cases, started at about 30 to 35% 3 weeks ago. We want to see that number come down, and it has very steadily since the safer at home order. And actually, we even saw some trends starting when the municipalities had some local restrictions on the social distancing. The doubling time, again, we want to see that stretch out. That's the time that it takes for us to double the number of COVID positive cases, either in Milwaukee or Wisconsin. And we started out around 2.5 days when we first started, and now that's out to almost 6.5 days, which is really good progress.
Another question for you, Dr. Raymond. There have been reports that some hospital systems in our area are down to about a week's worth of PPE equipment. Do you know if that's the case? I know it's probably hard to generalize across all the health systems in our area.
Right. Well, I'm not a spokesperson for the individual health systems, but I know that PPE is a challenge, and that I think if all the health systems had a week's worth of PPE, they'd actually be extremely happy. I think the numbers are much less than that.
Absolutely.
And if I can add, I've had conversations with the federally qualified health centers. They are facing the same issue, very much so. 16th Street Health Clinic, Progressive, they're also in need of PPE as well.
And Tim, if I could just weigh in here, one of the things we need to think about when we restart the economy is, what are we going to do for our workers that are in the hospitality industry, people that drive our buses? We really need to make sure that we're prepared to protect them.
Great point.
Yeah, I had a question for Mayor Barrett, and it kind of builds on a theme you were talking about a little bit earlier. I guess the U.S. Surgeon General earlier today also addressed the need to get the word out among underrepresented minority communities about stopping the spread. What else can we do as a community to get that word out to everybody?
Well, again, some of it is not going through traditional channels. Some of it is working through neighborhood groups. Ironically, one of the places where I have traditionally relied on are the churches, because the churches can certainly reach a lot more people and people in a different way than government can, but they're hamstrung right now because they don't have the same ability to reach people. So what is usually one of my best avenues for reaching people in the community, the church is somewhat hampered in that. That's why the help from the medical college and advancing a healthier Wisconsin is so important, because some of this is getting creative, and the challenge, of course, is we don't want a lot of people on the street, but we want to get the message on the street that it's safer to stay at home. So we continually try to make sure that we have a message that's suited for the different audiences. There's going to be a different message in the Hispanic neighborhoods. We want to reach the Hmong neighborhoods. We want to reach the African American neighborhoods, and do so in a way that is respectful of the nuances of those neighborhoods.
Another question about, a couple of questions about PPE. Are there other solutions in a shortage like this? And has the federal government provided anything from the national stockpile?
There are compromise solutions. People are reusing PPE, and there are new ways to sterilize the PPE and for the frontline healthcare providers. But the CDC had new guidance now about a week and a half ago where they encouraged people to wear cloth face coverings in public. It primarily is meant to prevent you from spreading respiratory droplets to someone else. It may give you a little bit of protection, but it also sends a message that you're serious about socially distancing and that we're all in this together. But other than that, I don't believe that we've received meaningful amounts of PPE from the federal stockpile here in Wisconsin.
And to make matters worse, and you can correct me if I'm wrong here, Dr. Raymond, is the reports I've seen is that the national stockpiles are about 90% depleted now. And so I don't think that we can really rely on that, certainly in the short run.
Dr. Raymond, another question. Do you have any sense of how many procedures have been delayed or canceled because of this outbreak, unrelated to COVID-19?
I can't give you the exact number, but I can tell you our practice has redeployed our personnel and all of the assets that we have to create surge capacity with our 2 hospital partners, 3 hospital partners, Schrader Children's and the VA. And that because of that, we're not doing endoscopies and routine catheterizations and many surgeries that we normally would. So it's been a challenge for us just in terms of our cash flow and our finances.
All right, and that'll do it for our audience questions. Thank you to everybody who submitted a question.
Yeah, again, grateful for you, Mayor Barrett. I know how busy you are. Best of luck on the outcome, delayed of the election. And Dr. Raymond, I thought since this is Friday, I would finish with a question I haven't asked you, and I'll give you 3 shots at it. Do you have a favorite book, a favorite movie, or a favorite TV show when you're not doing this that you watch, read, or enjoy?
I think my favorite recent TV show is Baas. I got to binge watch that with my wife a while ago.
Very good. I thought I'd give you a little high note to end on here on the week.
Thanks.
Mayor, again, thank you. Have a safe weekend. Pardon?
Let's all remember the Brewers are undefeated. So,
yeah, thank you. Good.
Have a good weekend.
Well, everyone have a good, safe weekend. We'll be back with you 3:30 on Monday. Again, enjoy. Thank you.
Thank you.